Hello, this is Patty Munch. I am the practice manager for Harrington Physician Services Orthopedics, and on behalf of Harrington Healthcare System, we thank you for choosing us to have your joint replacement surgery with us. The purpose of this video is to give you a brief overview of the services that will be provided to you after surgery, the day before surgery, and during pre-admission testing. We'll start with what brings you to your decision for surgery. If you're having a knee replacement, you probably heard from your surgeon that you have either bone-on-bone, bone spurs, or severe arthritis. What will happen during the surgery is the doctors will remove the bone that has the osteoarthritis in it and replace it with a knee replacement. The knee replacement is titanium and has a polyethylene component here, and they use joint cement to put it in the top, both in your femur and in your tibia. Once you have that old bone removed, it will be replaced with these nice smooth surfaces. You can see glides very easily, no more grinding, no more bone pain. Same thing with the hip replacement. The hip replacement is if you have arthritis or bone spurs in your hip that has reduced your range of motion, they will go in and remove the diseased bone and replace it with a component that looks like this. This is the ball and socket joint. So this is the ball piece that has a titanium femur component, and the cup has a polyethylene cap inside. Nice and smooth, easy movements. The shoulder replacement is the same principle as a hip replacement. It's a ball and socket joint, so they replace the shoulder, the top of your shoulder, with a polyethylene cap, and then the ball, the head of your humerus, gets replaced with something similar to like in your hip replacement. So once you're done with surgery, you'll go into the recovery area. The surgery itself usually takes anywhere from 1 to 2.5 hours, depending on the complexity of your surgery. For planning purposes, if you have someone waiting for you, we usually say plan on surgery taking 3 hours. So once a decision for surgery is made, you will get an appointment from our surgical scheduler, Edwina. She will give you your surgery date and your pre-admission testing date. Pre-admission testing will be a physical by one of our nurse practitioners or physician's assistants, and you will have blood test, EKG, and a complete physical exam. After pre-admission testing is completed, you will be ready for your surgery date. That date, on the day of surgery, you report to the main entrance of the hospital. They will instruct you to go up to the 3rd floor. If you have someone bringing you, they may stay with you at this point in time and wait in our surgical waiting area. If they don't care to wait in the hospital, they can wait out in their car, or you can wait at home and we'll call you. You will need transportation to surgery and the day you are released from surgery. You will need to have a ride home. The other departments that will be involved in this program are going to be physical therapy, occupational therapy, anesthesia, and nursing. Each one of those services will give you a brief overview of what to expect the day of surgery and after surgery. Care management will also be reaching out to you at your pre-admission testing appointment to help you set up services that you may need in your home after surgery is done. Most of our patients do go home after a knee replacement or a hip replacement after one overnight stay. Some people do need longer depending on their pain control, and if you're a fall risk, the physical therapy department will work with you until you are not a fall risk any longer and you are able to go home safely. If you're not able to go home, based on physical therapy's recommendation, there's short-term rehab as well as rehab facilities that you could be placed in by our care management team to help you get to the point where you are able to go home safely. I want to add one important fact is that there is a physician on call for orthopedics 24/7. In the event that you have a problem after surgery, we would like to hear from you. When we want to hear from you, any signs of infection, red, hot, swollen area, some drainage that does not look like regular clear drainage, we want to hear from you. If you have a fever of 100 or more, we want to hear from you. We also want to hear from you if you have any signs of a blood clot. Blood clots can present themselves with pain behind your calf, pain behind your knee, pain in your arms, any shortness of breath, cough that was strange and you haven't had that before, or some people present with hiccups that won't go away. If you have any of those symptoms, we do want to hear from you right away. You call the main number of 508-764-2772 and ask to speak to the orthopedic surgeon on call. It could be as simple as a chest x-ray or an ultrasound to rule out any possibilities of a blood clot, but we want to make sure that you are eliminating that possibility. We also want to make sure that you have a safe environment for home. Once you have made the decision for surgery, you have your surgery date, it's good to prepare for your arrival home. What you need to look for is a safe area in the bathroom. Most accidents with people happen in the bathroom after surgery. You have limited range of motion. Getting on and off the toilet is not as easy as it was before. You want to make sure that you consider grab rails in the bathroom, especially if you have a step-in tub. You want to look at perhaps a shower chair. You want to look at a grab rail inside the shower if that's a possibility. If it's not, the shower chair is a good option. There's also a handheld shower device that you can just buy on Amazon. It's like $12 that you can attach to your shower so that you can do a handheld shower sitting down on a shower chair. We want to make sure that you're safe once you're home. Care management will do their best to reach out to you. You should hear from someone from physical therapy, occupational therapy if needed, or nursing the first day you're home. Not the day you get sent home, but the next day you should be hearing from someone in that service to reach out to you to make sure that they have something set up to come into your home. If you have any questions or concerns, please make sure you call the office at 508-764-2772, and we'll be happy to help you with anything that comes up. We, again, thank you for choosing Harrington Healthcare for your joint replacement surgery.
Hi, my name is Christine Santos. I'm a registered nurse here at Harrington Hospital. And today I'm going to talk to you a little about what to expect when you come in for your pre-admission testing appointment, your day of surgery, and your care of nursing care after your surgery. So we'll start with the pre-admission testing. So your pre-admission testing appointment will be booked by the orthopedic office, and normally that's about 2 weeks prior to your surgical date. During that time, you're going to be seen by a nurse practitioner. They'll be reviewing your health history with you, going over your medications with you. We also ask that when you do come in that you bring in an accurate list of your medications, which includes your vitamins, over-the-counter medications, also bringing your insurance card with you, and a healthcare proxy if you happen to have that filled out. So the nurses will go over your health history with you. They'll also be doing what's called a MRSA screen. That's standard protocol for all joint replacements coming in. And what we want to do is we swab the nasal passageway, and we also swab the areas of the groin. We want to see if you have a bacteria on your skin, which is called Staphylococcus, which is resistant to certain antibiotics. So we want to make sure that we're protecting you with the correct antibiotic on the morning of your surgery. You'll also be giving some Sage wipes. Those are antibacterial wipes that we actually instruct you on how to use those prior to your surgery. The nurse will go over those with you. During your pre-admission testing, they'll also be probably drawing your blood, doing a chest x-ray, and also an EKG. All those will help us to clear you for your surgery. You will also be followed up with your primary care doctor, and if you do see a cardiologist or a pulmonologist, you'll be asked to be seen by them. They help clear you for your surgery. When you're all set and cleared for your surgery, the office will be calling you for the morning of surgery, telling you what time to come in for. When you do come in, please check in the main lobby of the hospital. They'll direct you up to the 3rd floor to day surgery. During that time, when you reach the day surgery department, the nurses will be greeting you, and they'll be bringing you into your room and getting you ready for your surgery. During that time, you'll have to get undressed and into a Johnny. Also, they'll be starting your IV, and you'll be getting some medications to prepare you for your surgery and to also help for pain control post-op. You'll be seen by the anesthesiologist. You'll also be seen by the nurse anesthetist, the operating room nurse, and your surgeon. Once they have all seen you and you're ready to go into surgery, you'll be brought into the operating room. And normally by the time you leave the ambulatory care department and finish your surgery and reach the recovery room, it's approximately 2.5 to 3 hours. When your surgery is complete, you'll be brought into the recovery room. And in the recovery room, the nurses will be taking care of you, monitoring your pain control, monitoring your vital signs. Most patients remain in the recovery room for approximately 2 hours. Some stay longer if you do need to. When you meet their criteria and you're ready to go back to the floor, the nurses in the recovery room will call your nurse to come and pick you up. Some of you may be going back to the med-surg floor and staying 2 to 3 days. Some of you may be going back to the ambulatory care department. Will you be cared for there and be going home the same day? Following up with your nursing care when you reach back to the floor or to the ambulatory care. We want your recovery from your procedure to be as seamless and as comfortable as possible. During the hospital stay, the nursing staff will care for you and assist you in many different aspects of your care. We will always be asking you for 2 identifiers. So we always ask you your name and your date of birth before any care. We also be making sure that you get up and out of bed as soon as possible, and that is with the help of the physical therapist. If you are having hip surgery, we do use a pillow between your legs. It's called an abductor pillow, or sometimes just bedside pillows. That's to help maintain your care for your post-op hip. You'll be getting IV fluids. Those will be continued through intravenously, usually until you can be taking something by mouth and have no nausea, but we will discontinue those as soon as we can. Bowel medications, very important that you have some type of bowel medication regime, usually a laxative or a stool softener, because most of you are not getting up and moving as much as you used to. And also with anesthesia and pain medications, it can cause constipation. So we want to be sure that we are giving you medications to help you to move your bowels. Incentive spirometry, that's a breathing machine that we use. It's just a plastic machine that you actually breathe into, which helps expand your lung fields to help prevent you from pneumonia. Sequential compression devices, those are sleeves that we actually wrap around your lower calf area. And what they do is they hug and let go and hug and let go, which helps create circulation to prevent blood clots also. And a cold therapy system, what that is a pad that's wrapped around your knee, and it constantly is giving cold fluids through it, which is a constant ice pack. And any of you have a diagnosis of obstructive sleep apnea, we ask that you please bring your CPAP with you if you do use it at home. We want to make sure that when you're ready to go home, whether that's from the med-surg floor or from the ambulatory care department, that you make sure that you have full education so that you can take care of things when you are at home. So the following discharge topics that we will go over is incisional care. We'll tell you when the dressing can come off, if you have a dressing off. We'll also make sure that you'll know when you can get it wet or you can shower. Pain management, we'll go over your pain medications that the doctor's sending you home on, and we will make sure that you understand them and you're taking them appropriately. Swelling management, that's along with the ice pack and the constant machine that we'll send you home with. We'll educate you on that. Anticoagulation, which means something to help thin your blood to prevent blood clots. We will go over that with you also. Most of you will be going home on just aspirin, but occasionally they do change it and give you other medications. We will make sure that you're educated on that. Activity progression and exercise, physical therapy will go over that with you, tell you what you need to do. And most of you, if you do go home, you will have outpatient physical therapy set up with you. Activities of daily living and the use of adaptive equipment. That can be a range of things, meaning from a walker to commodes, to grabber assistance to help you to get things off the floor, to a cane. But we'll definitely make sure that you are aware of all of that, and physical therapy will go over that with you also. So again, if there's ever any questions when you're here, please make sure that you let anyone who's caring for you ask them any questions that you have. And I look forward to seeing you on your morning of surgery. Again, my name is Christine Santos. I'm a registered nurse at Harrington Hospital. Thank you.
Hi there, my name is Dr. Jim Faust, and I'm the Chief of Anesthesia at Harrington Hospital. And I'm here to talk with you a little bit today about anesthesia and your total joint replacement. And I want to welcome you because we're excited to take care of you, and we're excited to give you the very best outcome that you can have, which our goal is for you to no longer be dealing with your pain and to be able to increase activity in your life and improve your quality of life. So we work very hard, and as you see from this slide presentation and a few other speakers, that we have quite a team put together to make sure that we do our very best to give you the best outcome. Now, the best outcome has to do with a lot of different things. The first and foremost part is going to be making sure that you're as good as you can be before you come in for your joint replacement. By that, I mean we want to make sure that your medical issues have been optimized. Medical issues such as glucose control if you're diabetic, weight control if you're overweight, tobacco abuse if you happen to be a smoker, nutrition, as well as making sure that if you have sleep apnea or have any concerns that you might have sleep apnea, that it be diagnosed and treated. Let me talk specifically about a couple of those things. Glucose control in diabetes is very, very important, not only in terms of preventing infections after your operation. And let me tell you that an infection after a total joint replacement can be a very big deal, because sometimes it means taking out the actual implants. We want to avoid that. And glucose control is one of the biggest factors that plays a role there. We look at your hemoglobin A1C, and you may be familiar with that term. It tells us a little bit about your overall glucose control. And we're looking at for it to be 7 or less. If it's higher than that, we want it better. And we want that to occur before you come in to have your surgery. Weight loss is also very important. We know that if your BMI is above 40, you have a significantly higher chance of having an infection where the total joint is done. And tobacco, well, you probably don't need me to tell you about the risks of tobacco in terms of heart attack and strokes and certainly cancers. But that also plays a very big role in increasing the risks of infection after a total joint. We don't want anybody smoking at all before they come in for their total joint. We would like you to quit before you have your total joint done. That's very, very important if you want to have a good outcome. These are the things that you need to do in order to help us provide you with the best outcome. Now, once you've been optimized, you'll go through the pre-test clinic and you'll chat with the folks there. They'll do a history and a physical exam, and we'll do some blood work and an EKG. And we're really going to take a good look at you and make sure that everything looks as though you're ready to go for your surgery. Once you pass those tests, you will then come in on your day of surgery and you'll meet us. Now, my department consists of 4 different anesthesiologists or anesthesia doctors. I'm one of them. There are 3 others. We all have a tremendous amount of experience. I've been in practice for almost 30 years, as been the same is true for my other 3 partners. We also have 5 nurse anesthetists, and involved in your care, in addition to one of us, the anesthesiologist, you'll have a nurse anesthetist, a nurse who specializes in providing anesthesia. And that will be your anesthesia team that day. And we will be solely focused on taking care of you when you come in. Now, the type of anesthesia that we use on the day of surgery is typically spinal anesthesia. Now, don't overreact to that. Some of you think, oh, I had a spinal 40 years ago and I got a bad headache, or you hear different horror stories about spinals, but spinals are very safely and commonly done these days. And spinal actually offers a very big advantage to you when you're having either your hip or your knee replaced, in that it decreases the chances of getting a blood clot in your legs afterwards. Now, that doesn't happen a lot, but it happens more commonly in surgery, and it's a potentially fatal complication. So we want to be able to use that spinal if it works out. And I would say we do spinals in about 95% of our total joint patients. Now, you may be thinking that since we're going to do this under spinal, that you're going to be wide awake during the case, and you couldn't be farther from it. You're still going to sleep through the operation. We're going to give you some other medicines and just make it that you drift off to sleep. The next thing you know, you're in the recovery room, waking up, and everything's all done. Then we'll take you over to the recovery room where our specialized nurses in recovery will take care of you. And you'll hear a little bit more about that from one of the nurses who manages that unit. So let me finish up just by saying that I'm glad that I've had the opportunity to speak with you today. I can't tell you how much we look forward to seeing you, taking care of you. and giving you a great new joint so that you can go on and do all the things that you haven't had a chance to do.
Hi, I'm Sarah. I'm one of the physical therapists that works at the hospital. Physical therapy usually starts the same day of surgery. We'll typically see you as soon as you have sensation back in your legs. And most people that have their knee replaced do go home the day of surgery. So that means we'll be getting you up, walking. If you have stairs to get into your house, we'll be trying stairs with you to make sure that you're safe to go home. We do push on your knee to help with bending and regaining motion. So I like to always warn people about that so they're not surprised or thrown off when someone comes in and starts moving their knee around. It can be uncomfortable initially, but you'll thank us later. If you're having your hip replaced, we also try to see you the same day of surgery. Occasionally, if there's like you don't go in till later, or if you're just something happens, we end up seeing you the next morning. Some people that have their hip replaced do go home same day. Oftentimes, though, you stay overnight and we'll go home the next day. After surgery, we typically get you up using a walker, and that's if you have your knee or hip done. If you don't have a walker currently, we recommend that you get one ahead of time, practice, make sure that you can get around your house, room to room safely with it. A lot of you will go to physical therapy before surgery where you'll learn some exercises. If you have done that or are planning to, we do encourage you to be faithful about doing those exercises because they really do make a difference in your outcome. Patients typically go home after the surgery. It's pretty rare that you go to rehab after a planned joint replacement. However, if something happens or you're just not safe or aren't able to, then occasionally people will go to rehab. That would be pending physical therapy recommendations, insurance approval, and bed availability.
Hi there, my name's Karen. I'm an occupational therapist. I work on things like self-care, functional mobility, strength, endurance, home modification, and adaptive equipment. Today, I'd like to talk about things that might make your life easier after surgery. Some things to keep in mind. Tall chairs and toilets are easier to get on and off of than low ones. Chairs with arms are easier than chairs without. Firm cushions are easier than soft ones. Soft, low couches are difficult to get out of. If you need to sleep on the main floor for a few nights, make preparations beforehand. Stock your home with non-perishable food. Prepare and freeze food ahead of time. Wear slip-on shoes with good support or use elastic shoelaces to make shoes slip on. Keep your phone within easy reach. Adaptive equipment can help you maintain your independence, increase your mobility after surgery. If you're having knee or hip surgery, when you return home, you will be using a rolling walker, a cane, or crutches to get around. Before surgery, it is a good time to modify your home in preparation for your limited mobility. Put rails on the entrance stairs. Remove scatter rugs. Keep walkways clear. Provide good lighting for day and night. Use motion sensor night lights. Keep regularly used items within easy reach. Install grab bars in showers and next to toilets. Use comfort height toilets, raised toilet seats, or bedside commodes over toilets. Think about whether you need a tub seat, a tub bench, a shower chair, a handheld shower spray, or a non-slip mat in your shower. Do you have trouble getting in and out of your bed? Do you need a bed rail? Can you sleep in a recliner for a few days? Check your home for sturdy chairs with arms and then place them around your home in areas you may need them. Attach a basket or plastic bag to your rolling walker to carry things from one place to another. Raise the height of chairs by placing risers under the feet or adding firm cushions. Total hip replacements have to follow strict precautions for the first few months after surgery. There are certain positions that have to be avoided to prevent possible dislocation and allow time for healing. Some of these precautions affect regular self-care activities. With certain hip precautions, special adaptive equipment for lower body dressing will have to be purchased, like a long-handled reacher, sock aid, and long-handled shoehorn, or someone will have to help with lower body dressing at home. 2 different hip surgeries are performed at Harrington. Discuss with your doctor which one you will be undergoing and the particular precautions associated with your surgery. At the hospital, your individual total hip precautions will be gone over in depth during your stay. If you are having shoulder surgery, your arm will be in a sling for weeks and you will have limited use of your arm. Before surgery, practice daily tasks with your other arm only. Stock your home with non-perishable food, prepare and freeze food ahead of time. You might be more comfortable in a recliner to start with, and practice toilet hygiene with your opposite hand. Adaptive equipment is recommended for total hip replacements with posterior hip precautions, but they are also beneficial for total knee replacements who are experiencing decreased flexibility and mobility. Here's some adaptive equipment that you might be interested in. This is a sock aid. This will help put socks on. You put a sock over the top and then you hold on to the rope, throw it in front of your foot and pull it on and it'll go right on. This is a long-handed reacher. This will help extend your arm length. And this is a long-handled shoehorn. Where to find adaptive equipment? You can find adaptive equipment in many places. Family and friends, senior centers, churches, yard sales, durable medical supply companies in surrounding towns, online at Amazon or other durable medical supply companies, stores like Walmart, Rite Aids, Walgreens, CVS. Prices vary greatly, so shop around. Most insurances will not cover adaptive equipment. Ask your insurance company.
Hi, I'm Patty Munch. I'm the practice manager for the orthopedic department, and we're discussing preparing you for surgery as far as nutrition. It's very important that you eat a healthy, well-balanced diet once you have the decision for surgery made. You should avoid any significant increase in weight or decrease in weight once you get your surgery date. You should maintain an adequate nutrition stores and your muscle mass by keeping your well-balanced diet. Strength for healing and rehabilitation is obtained through your nutrition. So you want to make sure that you're keeping a high fiber, high protein diet prior to surgery and after surgery. If you are a diabetic or you have elevated blood sugars, it's really important that you keep your A1C under 7. If it goes over 7, we may postpone your surgery. Elevated blood sugar will impact your ability to heal. And preparing for your meals after surgery. Once you get home, you will have some mobility issues. So it'd be important for you to prepare some meals ahead of time that you can freeze and just pop in the microwave or heat up quickly in the oven. So if you have a turkey left over, maybe you want to freeze it from Thanksgiving. If you make extra meals over the holidays, just freeze some. And that way you'll have some meals prepared for when you're home from surgery. It's important that you have a diet high in protein and vitamin C. So that's meats, any kind of poultry, that would be seafood that you could eat that will give you elevated protein. If you do not like meat, you could do a tofu that also gives you a high amount of protein. Combined with vitamin C. Vitamin C helps you absorb iron. So after surgery, you may have a little bit of an iron depletion. So you may want to consider really increasing your vitamin C and protein. That will help you gain your strength back after the surgery. You may want to consider keeping something in the house when you get home that you really like to eat. That's maybe a fortified cereal, yogurt with some granola, something that you can get into your belly if when you get home, your appetite might be a little bit less after surgery. So you want to make sure you have something that you can eat just to keep your nutrition up, as well as to have something in your stomach while you're taking pain medicines. That's really important. There are some avenues for you to obtain meals that are prepared. There are some restaurants that have prepared meals. You could do takeout that can be delivered to your home. There are restaurants in the Sturbridge area that have frozen meals that are delicious that you can take home. And if you are really in a pinch for transportation, you can look into getting Meals on Wheels, and that would be set up through your primary care physician.
Hi, I'm Debbie Umansor, the Director of Care Management here at Harrington Hospital. You will see myself or one of the care managers at your pre-admission testing visit or in the hospital after your surgery. We try and see you in the pre-admission testing visit so that we can set up services for you prior to your surgery. Most patients having a total knee replacement will go home the same day or the next day. You will most likely go home with a visiting nurse agency that will provide a physical therapist in the home to continue your exercises to keep that knee moving. Patients that have total hip surgery sometimes go directly home as well, usually in a day or two. Some patients require short-term rehab. If you need short-term rehab, we will help set that up for you. You will choose what facility you would like to go to. It may have to be one that's contracted with your insurance company. You can go to www.medicare.gov Care Compare. This is a website that you can look at visiting nurse agencies listed as home health agencies or skilled nursing facilities. You can see the quality ratings on all of these agencies and facilities to make your determination of where you might want to go or whom you might want to provide services to you. We like to set up the services before you go home to make sure that we can get you onto the schedule. You will need to have seen your primary care physician within the last 6 months in order for the visiting nurse agency to provide services to you. A care manager will see you in your room after surgery to confirm all of your information. You will want to make sure that you have someone to drive you home after your surgery, someone who could pick up any prescription medications for you, and someone to help you out at home. You may also be contacted by our orthopedic nurse navigator. This is a new program here at Harrington Hospital. The nurse navigator will be helping patients who might not have everything in place that they need. We will work with your insurance agency and community partners to try and meet your needs.